All right, guys, we're going to talk about the prostate. There's a lot of false information about prostate. Number one, this theory out there that they say that too much testosterone, especially the most powerful type of testosterone, which is DHT, causes an enlarged prostate. Well, if that was true, then why is it that certain doctors use DHT as a therapy to shrink the prostate? It's not true that too much testosterone causes an enlargement of the prostate, simply because as you age, testosterone goes down. So why would you have an enlarged prostate if you get older? It's basically the estrogen. Testosterone and estrogen work together. When you lower testosterone, you raise estrogen. Estrogen is an anabolic hormone. It makes things enlarge. In a female, it will make a fibroid, a tumor, okay? In a male body, it will enlarge the prostate. So if you have prostate enlargement, it's because you have too much estrogen. Now, where does this estrogen come from? Well, first of all, your body can make it, or it can come from the foods that you eat. The glands that make estrogen in a male body are the adrenal glands. So there's also your own fat can make estrogen. So the fatter you are, the more estrogen you can have. And so we must reduce estrogen. Okay, a couple ways to do it is avoid food that has estrogen in it. You have hormone-free meats, all the GMO foods, genetically modified, soy, corn, beet sugar that are in the grocery store that are not labeled. They are very estrogenic because they're loaded with a pesticide that mimics estrogen. So unless you're doing organic food, you're getting a lot of GMO food, which is then going to increase estrogen amounts. Now, estrogen, it causes cancer. It causes prostate cancer. It causes cancer of the cervix in females and breast tissue and thyroid cancer. It's pretty nasty. So luckily, there are foods that naturally detoxify things that turn into cancer and estrogen itself. And it's called cruciferous foods. That would be like the kale, the broccoli, the Brussels sprouts, the cabbage, the radish, the arugula. You need to start eating those, okay? If you have a hard time eating those, do regular vegetables and you can enhance it with like a cruciferous concentrate. Okay, you can use that as well. And this has all the cruciferous with some other ones, but if you have a prostate problem, I would take probably 6 of these a day, okay? So that's one thing you can do. The other thing you can do is take sea kelp in the morning. Take one tablet. Sea kelp will also reduce estrogen. It's really good for the thyroid too. And it's good for if you have cold feet. Okay, so number 2, reduce aromatase. What is aromatase? That is an enzyme that's made by your body that converts the testosterone that you have left into estrogen. Great. So that's another thing that's happening too, is that we're actually converting testosterone, our bodies are making more estrogen. That's crazy. So having a lot of estrogen is very carcinogenic. It's going to increase your risk factors for cancer. So there are even medications that are aromatase inhibitors, okay, to fix cancer or to kill cancer. But you want to use the natural things that are aromatase inhibitors. And the best one that I know of is stinging nettle root. Stinging nettle root is a great plant or a root that you can get as a tablet form, and you want to actually double the dosage. It's great also as an anti-inflammatory. It's great to prevent hair loss. So this is like an awesome thing for the prostate. I consider it better than some of the saw palmetto stuff that you would get in some of the supplements. But if you have prostate, this is the one you need to get, and then you'll start noticing some really good changes. Okay? If you get up to pee at night, that should improve with the insulin correction as well, because that's really one of the side effects from insulin is excessive urination at night. So as you fix blood sugars, you will also pee less. So it may come from prostate enlargement, or it could come from the blood sugar issues. Okay? Hope this helped. Apply it, and I will see you in the next video.